Human metapneumovirus, or HMPV, is a respiratory virus that affects the respiratory tract. It's a common cause of coughs and colds, especially during the winter and early spring months. Discovered in 2001, HMPV is a global virus that has spread to every continent. It infects people of all ages, from infants to the elderly, and can spread easily in crowded places. Most people recover from HMPV without any problems, often with just rest and fluids. However, it can be serious for young children, older adults, and people with weakened immune systems, leading to complications like pneumonia. HMPV is a type of RNA virus and is part of the Paramyxoviridae family. It's closely related to the respiratory syncytial virus, or RSV, which is another common respiratory virus that causes similar symptoms. HMPV is often overlooked as a cause of respiratory illness because its symptoms, such as cough, fever, and nasal congestion, are very similar to other viruses. Understanding HMPV is important as it helps us to protect ourselves and others by practicing good hygiene and seeking medical advice when necessary. HMPV, or human metapneumovirus, spreads through respiratory droplets that are expelled into the air. These droplets are released when an infected person coughs, sneezes, or even talks, making it easy for the virus to spread. You can get infected by breathing in the virus from the air, especially in crowded places, or by touching a surface with the virus on it and then touching your eyes, nose, or mouth. This makes everyday activities a potential risk. HMPV spreads easily in close contact environments, including homes, schools, and daycare centers, where people are in close proximity and share common spaces. The virus can survive on surfaces for several hours, making it crucial to regularly clean and disinfect commonly touched objects and surfaces. People with HMPV are most contagious for 3 to 7 days after symptoms start, but they can still spread the virus even before they show any symptoms. You can still spread the virus even if you don't have symptoms, which makes it challenging to control the spread. Asymptomatic individuals can unknowingly infect others, contributing to the silent spread of HMPV. HMPV symptoms are similar to other respiratory infections. Symptoms usually appear 3 to 6 days after exposure. Common symptoms include a runny nose, cough, sore throat, fever, and wheezing. In severe cases, HMPV can cause bronchitis, pneumonia, and respiratory failure. These complications are more common in infants, young children, older adults, and people with weakened immune systems. Section 4. Protecting yourself and others from HMPV. Preventing HMPV spread involves simple hygiene practices. These include washing your hands frequently with soap and water, covering your mouth and nose when you cough or sneeze, avoiding close contact with sick people, and cleaning and disinfecting frequently touched surfaces. Currently, there is no vaccine for HMPV. However, researchers are working on developing one. Section 5. Treatment options for HMPV, conventional and homeopathic approaches. In this section, we will explore both conventional and homeopathic methods to manage and treat human metapneumovirus (HMPV) infections. Most HMPV infections resolve on their own, typically within a week or two. The body's immune system is usually capable of fighting off the virus without the need for extensive medical intervention. Treatment focuses on relieving symptoms, such as rest, fluids, and over-the-counter pain relievers and fever reducers. Staying hydrated and getting plenty of rest are crucial steps in aiding recovery. In severe cases, hospitalization may be necessary. This is particularly true for individuals with weakened immune systems, the elderly, or very young children who may experience more severe symptoms. This allows for oxygen therapy and mechanical ventilation, which can be life-saving measures for those experiencing significant respiratory distress. Homeopathic remedies may also provide relief. These natural treatments are designed to support the body's own healing processes and can be used alongside conventional treatments. These remedies aim to stimulate the body's natural healing abilities. Homeopathy operates on the principle of like cures like, using highly diluted substances to trigger the body's defense mechanisms. It is important to consult a qualified homeopathic practitioner. They can provide personalized advice and ensure that the remedies chosen are appropriate for your specific symptoms and overall health condition. Some commonly recommended remedies include aconitum for sudden onset of fever, chills, and anxiety. This remedy is often used at the early stages of an infection, bryonia for dry cough, worse from any movement. This remedy is particularly useful when the cough is painful and the patient prefers to remain still, and phosphorus for tight chest, worse from lying down in cold air. This remedy can help alleviate respiratory discomfort and is often used when symptoms are aggravated by cold conditions. It's important to remember that homeopathy is a complementary therapy and should not replace conventional medical treatment. It can be used to support overall well-being, but should be part of a broader treatment plan. Always consult a healthcare professional for diagnosis and treatment of HMPV. They can provide a comprehensive evaluation and recommend the best course of action. They can provide the best course of action for your specific situation, ensuring that you receive the most effective and appropriate care for your health needs.